quick outline, we're going to talk about corneal anatomy as well as techniques for evaluating the cornea, especially in the slit lamp, and then we are going to delve into speaking about corneal degeneration, dystrophy, as well as corneal ectasias. So again, looking at the different beams, we can see that different ways of illuminating and looking, magnifying, angling the light, doing retroillumination is going to provide us different views. Arcus is going to affect more than 60% of people by the time they're about 60 years old. If the patient is young, so if they're younger than about 50, 45 years old, and they have a nice dense arcus, we want to make sure that we're doing a cholesterol panel on these patients associated with UV exposure, more commonly nasally because you have the sun shining off of your nose into your nasal conjunctiva, can be vascularized, and you will usually see a Stockard's line, which is a line of iron deposits. The calcium deposition is associated with corneal exposure and tear film evaporation because as osmolarity of the tears increases, if there's a lot of tear evaporation. Morin's ulcer is idiopathic. We don't know the exact cause, but patients may have a concurrent hepatitis C, herpes simplex or zoster, syphilis, tuberculosis, and or previous ocular trauma or surgery. Go through and actually talk about these. So keratoconus is an ectatic central or inferior temporal corneal dystrophy that's associated with irregular astigmatism.